Go ahead. You can put X out, exit out. Put your middle name this time.
Physical assessment, thorax and lungs, anatomy review. Identify the physical landmarks when conducting a physical assessment of the thorax and lungs. Demonstrate the proper assessment techniques in an assessment of the thorax and lungs. Describe the physical landmarks when documenting physical assessment of the thorax and lungs.
An understanding of thoracic landmarks is integral to systematic examination of the thorax. Therefore, let's take a few minutes to review these landmarks before beginning our examination. The bony thorax encases the heart and lungs and partially covers the kidneys, spleen, stomach, and liver. The thorax consists of 12 pairs of ribs, their costal cartilages, and their attachments to the sternum and thoracic vertebrae. Portions of the cartilage form the costal margins.
Which of the following is not included in the definition of the thoracic cage?
Posteriorly, the lungs extend from above the scapulae to about the level of T10 on quiet inspiration and to T12 on deep inspiration. The left lung is divided into two lobes and looks like this: anteriorly, laterally, and posteriorly. The right lung is divided into three lobes and looks like this: anteriorly, laterally, and posteriorly. Note that the right middle lobe underlies the axilla. Later, you will auscultate this third lobe separately. Posteriorly, the lungs extend from above the scapulae to about the level of T10 on quiet inspiration and to T12 on deep inspiration. The left lung is divided into two lobes and looks like this: anteriorly, laterally, and posteriorly. The right lung is divided into three lobes and looks like this: anteriorly, laterally, and posteriorly. Note that the right middle lobe underlies the axilla. Later, you will auscultate this third lobe separately.
In the presentation, thank you for your participation.